Hey guys, Dr. Wayne here from Health and Physical Therapy and Chiropractic, and today we're going to be talking about ACL rehab. First thing we really want to talk about is with ACL, surgery or not surgery. With non-surgery, we've seen with some MRIs and recent studies is that the ACL can regrow within 6 months. However, it really depends on the patient and what their goals are. If you're trying to play a sport, yeah, we can get you back, but there's always some sort of instability at that knee. Some patients don't want to have surgery, and we'll work with them on their goal to get back to, playing some sort of recreational basketball or whatever sport they're doing. And if it's just more of like a weekend warrior type of thing, then we'll work with the patient. What I see the most is the surgical side of things. And what you'll see the most common in terms of grafts is a quadricep tendon graft, a patella tendon graft, a hamstring graft, a cadaver graft. Now, the first three are the most common. What I tend to see is the quad tendon graft because it's the most popular now. And studies do show that there's a smaller likelihood of re-tears in the future, but we'll get that into a little bit. Now, with the cadaver graft, we see that more in our older population when they do have an ACL tear. And the reason why is because they don't want to take any healthy tissue from that patient and there's less trauma. Now, when we talk about ACL rehab, there's really 5 stages that we kind of go through. Stage 1 is you're just right out of surgery. You're coming to us maybe around week 0 or maybe 2 weeks after rehab. And our main goal is reduce the swelling, reduce the inflammation, get the range of motion back, and get the thigh to work. What happens is after an injury like that, and especially after surgery, is there will be inhibition from the brain telling your body to not use that quad. So you'll see a lot of atrophy in that thigh muscle. The first few weeks or so, we're really just trying to get the range of motion to match up with the non-infected leg and get that quadricep to work. Now, in phase 2, that happens around maybe week 4 to about month 3. And what happens there, we're just trying to strengthen it. We're trying to load it a little bit more, get very comfortable with these exercises, continue to work on that quad strength and making sure that our goals align with the patient. Phase 3, this happens around month 4 to month 6. We call this like a quad plateau. What happens is the patient really does really, really well the first 2 phases. And then on that 3rd phase, they kind of plateau a bit. And the reason why is the brain's just trying to catch up and it's just building that quad over time. Phase 4 is around month 7 to month 9. And what happens there is that we're slowly getting the patient to feel comfortable with jogging, some plyometrics, sport-related activities, those type of things. And maybe they'll start kind of doing a little bit of practice here and there, maybe non-contact. We can kind of talk to the coach, the athletic trainer, and kind of see what does season look like for them. For phase 5, this is where the patient is really weaning off of physical therapy, and then we hand it off to their athletic trainer or strength coach or whatever they have at school or whatever facility they're at. And this is around month 9 to month 12 and beyond. And so what happens there is us as physical therapists, we're really just trying to tease out any small things that we can see with the patient with their specific sport. What we do here is that we always continuously strength test our patients. What happens is a lot of clinics, they will strength test with just their hands, and that's what people are taught in school. Nowadays, what we use a Tyndek machine, and it creates a number when you kick into it or when you pull into it for your hamstrings. And that gives us a good number to understand, okay, where is this patient at and how do we get them back to activity? Now, these are objective tests. We can't really fake this. And these numbers tell us whether or not you're ready for activity. So a lot of surgeons will say, oh, you're ready to run at month 4. But if the patient does not test well in their strength, what we usually want to look at is a quad index ratio. And what we'll do is we'll have them kick into this machine, we'll look at the numbers, and we'll look at how many pounds of force they can create and divide that by their body weight. The ratio that we want is around a 66 to 70% for that ratio to get them back just to do some sort of jogging or some sort of plyometric. Sometimes that can happen at month 4, but it can happen a little bit later depending on other complications with the surgery. From there, we really, really want all those numbers to be around 95% to 100%, if not more, of the uninvolved side. And then as we start getting more into sport related activities and training, we will figure out, okay, does this patient move well? Do they have a psychological block? Is there something else that's kind of limiting them? We want to make sure that they can return to sport and feel comfortable doing that sport without having the risk of re-tearing the other one or that same side again. There's questions about braces and what we should do. A lot of people will go to their surgeon and get what we call like a DonJoy one. They'll get fitted for one that has carbon fiber and everything, and you'll see it a lot with our football players. What I usually have my patients do is if they feel comfortable, they don't really need one. But if the surgeon pushes for it or the coach pushes for it, we'll talk to them and say, okay, maybe get that brace, but we want to wean off of it as season starts or as they start getting back into sport. The reason why is because this gives a limitation on that leg, but also makes it a little weaker. So they tend to favor a little bit more. Those are kind of some things that we see often. Rehab tends to be about 12 months. It can be a little bit less if your numbers do hit those goals early, but we try to make sure that you get back as soon as you can and as safe as you can, depending on the numbers. If you guys would do so, please drop a like, give us a follow, and peace out.
Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.